Good day, I am Jasmine Carlin Emeldines from BSN 1A. I will be assessing my clients for lower extremities. So first that I am going to do is to introduce myself to the client. So hello sir, may I know your name and birthday?
I am Christian Calibayan. I am born June 16, 2003.
Okay sir, I will assess your lower extremities to check if there are any abnormalities. So please be comfortable. So before doing the assessment, make sure that you perform hand washing, explain the procedure to the client so that he will be aware on what I'm going to do with him, and always provide privacy to the client. First, check the legs and feet of the client for skin turgor, varicosities, lesions, edema, swelling, discoloration, scars, rashes, temperature, and muscle mass. Next is palpate the hips, thigh, patella, popliteal pulse, calves, Achilles tendon, calcaneus, medial and lateral malleoli, posterior tibial pulse, dorsalis pedis pulse, metatarsals, and toes. And for the Blanche test, next is check the range of motion of the leg of the client. Sir, can you raise your leg at a 90-degree angle from the examination table, then keep your knees straight and back down? Following on your one leg for the abduction, adduction, flexion, extension, external rotation, internal rotation, and butt kicks. Okay, on the other leg, abduction, adduction, flexion, extension, external rotation, internal rotation, and butt kicks. Next is I will test the leg of the patient against resistance. So I will position my client in a supine position to do this. Sir, can you raise one leg as I press down on it? Other. Okay. Then I will place my hand under your lower leg. Then I will push the leg up as he pushes the leg down. Okay. Next is I will place again my hand on your foot or the dorsal, and I will try to pull it while you pull the leg from my hand. Okay, the other. Okay, thank you. Now I will place my hand on the sole of the foot and push it while I attempt to push my hand. Okay. Next is I will position you in a sitting position, then I will place my hands on your thigh and try to lift your leg against resistance. Okay, the other. Okay, then I will place my hand under your thigh and try to push my hands down against resistance. Okay, the other. Okay. Next is I will place one hand on the lower leg, and can you please extend your leg against the resistance? Okay. The other. Okay. Then I will place my hand at the back of the lower leg, and can you please flex your leg against resistance? Okay. Okay. So next is check the range of motion of the feet. Can you perform dorsiflexion then plantar flexion? Okay, on the other side. Okay, can you perform internal and external rotation? Okay, the other side. The extension and flexion of the toes. Okay. Okay. Next is check the feet against resistance. So, place both hands on the client's feet. So, sir, can you dorsiflect your feet against the resistance? Okay. Then the other feet. Okay. Then I will place my both hands on the sole of your feet. And sir, can you plantar flex them against resistance? Okay. Okay. So next is I will check for the symmetry of the iliac crest of my patient. Then I will check the range of motion of the hips. So sir, can you lean forward, backward, to the side, to the other side, and then twist your hips from side. Next is I will palpate for crepitus. To the other side. Okay. Based on the results of assessing the lower extremities, there is no sign of abnormalities and there is no problem with my client's lower extremities. That's all. Thank you.